Up next on The Reveal, the faces behind the numbers in the COVID crisis.
I've always felt called to this profession.
But it comes with a heavy burden.
There's this uncertainty about when will this end?
Why some of the front lines are still struggling to find the right equipment.
The entire world is struggling with finding face masks.
People are feeling isolated, people are dealing with depression, people are worried.
And during the most challenging times, we hear from leaders of faith.
Human touch is so important to every faith tradition and to human beings, and we've just lost that.
From our Midtown studios in Atlanta, The Reveal begins now with our multi-Emmy and National Mural Award-winning team of investigators.
Welcome to The Reveal, an investigative show making a difference. I'm Rebecca Lindstrom. When COVID started to creep into our community, the hero signs went up at the hospitals. We all knew those on the front lines were putting their own lives at risk. Since March, more than 100 healthcare workers in Georgia have died with the virus, 19,000 infected, and just about every nurse, doctor, and respiratory therapist you talk with is starting to feel the fatigue.
My name is Dr. Jennifer Barbary. I'm a pulmonary critical care doctor. This is what I put on when I go in a COVID patient's room. I take my white coat off and my head is covered with a bonnet and my face is covered with this, but I try to compensate that by, making eye contact and touching the patient and, letting them know who I am. It's hard to talk in one of these, so I found my voice getting hoarse. I've always felt called to this profession, but it comes with a heavier burden each time you walk through the doors now.
When you say burden, what are you feeling?
There's this uncertainty about when will this end. There's days where I walk in that I just don't want to put on my mask. I don't want to do it anymore. But then I get an encouraging text from a nurse that I work with, or a sweet note from my daughters or my husband. My husband has really had to pick up and do more than his share. We are definitely a good team. I'm told that our numbers are going down a little bit.
Does it feel that way?
It does not feel that way, no. To hear patients say in desperation, I just want to go home and be with my family, it's hard. We had a 83-year-old gentleman, after being in the hospital for 6 weeks, survived to leave the hospital. Yay! One of the nice things for me that day was to be able to get to see his family for the first time face to face. And to put a name with the face, people that I had been talking to.
This is a moment of celebration and happiness, and yet still clearly very emotional for you. Why?
I think a lot of it is the victories seem fewer in my field and the patients I'm seeing. They're the sickest of the sick. Death can sometimes be overwhelming. Last week I had a gentleman that I had to have a tough conversation with about going on the ventilator, and he asked me to pray with him before we put him on the ventilator. And he passed away a couple of days ago. So knowing that was the last words he heard, just makes me thankful that I got to be a part of that. I hope that this doesn't continue for too much longer, because I don't think it is sustainable. I think there's going to be a high degree of burnout for physicians and healthcare workers. I encourage everybody to wear a mask. If you can do something to protect somebody else, it's a small gesture. I see it as a gesture of kindness for your neighbor.
More than 70 hospitals and nursing homes have asked for help with staffing, and Georgia has responded, spending more than $53 million by mid-July to hire more critical care nurses and doctors. But knowing where to add more bed space requires knowing just who is at risk. Behind each data point, there is a face, someone recovering from COVID or a loved one lost. I can show you their picture, maybe tell you their name, but there is one data point that has no face.
As we've had an increased number of tests coming in, rather than knowing more about each case, we're knowing less. So.
Dr. Harry Hyman with Georgia State School of Public Health is talking about these numbers in bars labeled unknown. 4 months into the virus's reach in Georgia, and of the confirmed cases, we have no idea where 2,500 of them live, making it tough to track hotspots. It's a similar problem for age, especially important to track as kids go back to school.
I think we don't know that data because we've never put in place the systems to ensure that we collect that data.
The biggest and perhaps most concerning unknown is race and ethnicity. We have no idea the makeup of more than a third of our COVID cases.
We were not consistently collecting racial and ethnic data up until about April, May.
If we did, DeKalb Public Health Director Dr. Elizabeth Ford believes these bars that represent Black and Hispanic people would grow, magnifying the real toll of the virus on those communities.
There are a certain number of people who just don't, who don't answer, or they think it's too complicated. Like they'll say, well, my father's Hispanic, my mother's Black.
Fulton County has the highest number of cases. And despite this 19-page report breaking down everything from zip codes to hospitalization, 1/3 of its data related to race is missing. Missing race data leads to gaps in understanding about the virus. That's why public health officials are trying to shift strategies to make sure every case counts. While counties may now be asking for this information, not all private labs are on board.
What we need right now is leadership from our state commissioner at the Department of Public Health to say this is critical data.
Up next on The Reveal.
I felt like there was just pain and poking at my head, and someone was like, poke, 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 poke.
The COVID crisis through the eyes of its youngest victims.
For more on these investigations or to submit a tip to the Reveal team, text REVEAL to 404-873-9114 or email us at thereveal@11alive.com.
Welcome back to The Reveal. School-age children make up less than 10% of Georgia's COVID cases, but with school districts debating just what's best to keep them safe, a CDC study finds there's risks even with staying at home. In more than half of the houses with a sick parent, at least one other person got sick. That's even after the infected person slept in another room, used a different bathroom, and wore a mask. Men were more likely to spread it than women, and adults were more likely to give it to their children than to their spouse. But 12-year-old Anaya Davis doesn't need a study to know any of that.
I felt like there was just pain and poking at my head, and someone was like, poke, 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 poke.
If you've never had COVID, Anaya Davis says this is what it feels like.
I felt like COVID was in my lungs and it hurt, and that scared me.
From her head to her lungs to her stomach.
She drew her emotions. She felt this COVID, that the pain that she had and what she felt, she drew it.
She wished for a superhero.
So he's doing this type of Spider-Man pose, shooting hand sanitizer out onto the street.
But it didn't work fast enough. The virus went from her dad to her mom.
Anaya's symptoms were way worse than mine. She had every symptom, like the no smell, no taste, the stomach ache, the chills. She had everything.
And in her self-isolation came loneliness.
I missed my sister. I missed her a lot.
So this one is, are you reaching for someone?
And the raindrops represent how give it the sad vibe. Yeah, I was definitely reaching out.
Were you ever scared?
Yeah, sometimes.
But a candid note from her sister did something Spider-Man couldn't.
You may not be the best sister, you can be mean sometimes, but I still love you and you need to get better. And then the next day, pow, I was better.
A 10-day fight worth fighting. A victory over the virus.
Be the boxer. Keep your head up. They get punched so many times, but they keep fighting. And the person who has COVID, or the person who needs to hear this, they need to keep fighting because I know they can get through it.
What's baffling about this virus is that as Anaya recovers, I talked with another little girl who's still struggling to regain her strength. Kira wants to go back to school, at least virtually, but 5 months after testing positive, she is still dealing with the lingering effects of COVID.
Let's play some more.
In this game of tic-tac-toe, Jeannie Johnson could care less who wins. She's just grateful her 9-year-old daughter has the energy to play.
Can play again? She can barely do 30 minutes of activity without being completely wiped out.
Kira has a mitochondrial disorder. Her body doesn't convert fat to energy. That has never stopped her from going to school, therapy, Girl Scouts, even musical theater. It took COVID-19 to change all that.
It's just been really heartbreaking watching what she's gone through, and the fact that, truly nobody knows what to do for her or how to help us.
It started with an unusual afternoon nap, then a fever and wheezing. But this was March, when COVID tests were only for people with severe symptoms. Over the next month, she would go back 3 more times in vain. It wasn't until Kira's dad also got sick that the family paid a private lab to run the test.
I was very angry to be pushed off so many times and to be dismissed pretty flippantly over a virus that nobody understands.
Johnson was right. Kira tested positive for COVID.
Children are a part of this pandemic as well.
Children's Hospital Medical Director for Epidemiology admits there is still a lot we don't know about COVID, especially in children. Dr. Andy Shane says in Georgia, the positive test rate is now about 9% in minors. Most can be treated at home. Dr. Shane says children fight off viral respiratory infections due to poor hygiene and constant contact with other kids. She wonders if that has helped their immune systems better fight this too.
There's also been some discussion about something called an ACE2 receptor, which is something that is found in the lungs and in the nasal passages. And children seem to have a decreased number of these receptors, thus making them perhaps less sensitive to the virus.
Latino and Black children are at least 5 times more likely to be hospitalized. The most common underlying health conditions, obesity and chronic lung disease. Dr. Shane says we have spent a lot of time trying to understand COVID's impact on the cardiovascular system that we're only now beginning to understand its impact neurologically.
Her quality of life is terrible.
That's why Johnson is sharing Kira's story. She wants parents to know children can be impacted. In the past 5 months, she says Kira has consistently had a low-grade fever, experienced night terrors, stomach aches, headaches, and a racing heartbeat. She has experienced problems with short-term memory.
Tic-tac-toe! Tic-tac-toe!
Johnson doesn't know how much is attributed to COVID, but more frustrating, neither do doctors.
I felt like I'm managing this pandemic disease all by myself.
Both Kira and Anaya shared their story to prove that children can get the virus and the effects can be devastating. Right now in Georgia, an average of 247 school-age children are testing positive for the virus each day.
Coming up, consumer beware.
The N95 masks problem has gone from, I would say, 600% increase in price.
While the number of new cases is steadily falling, there are about 2,000 people actively receiving hospital care for the virus. Hospitals say they're better stocked with personal protective gear to handle the caseload, but medical clinics and nursing homes say it is still tough to get what they need. That has triggered countless scams and new vendors, all hoping to cash in on the pandemic. Need masks, surgical gloves, or tusk kits? You can find it all on the dark web. You might remember this bust, a group in Thailand selling real masks.
The entire world is struggling with finding face masks, and these guys, A, find it, and B, sell it for not so much high of a price.
How? Pluck the masks out of the trash, wash and repackage.
Illegitimate items.
David Mayman leads a cybersecurity research group at Georgia State that received a grant to study how the dark web is evolving due to COVID.
We find that they haven't stopped selling illegal products. They just added another type of commodity that they're willing to sell.
Looking for remdesivir or hydroxychloroquine? This vendor claims to have it, and he can get you some heroin too. Some of these products are legit, it's just hard to know which ones. And while hospitals aren't likely going onto the dark web to buy this stuff, Mayman still worries that fraudulent products are still ending up there.
It could be a vendor, right, who ran out of face mask or hand sanitizer, and he has a list of customers that he he needs to provide with, and so he will go on the darknet and simply place an order.
The Georgia Hospital Association says vendors are still experiencing supply gaps, sending health clinics and hospitals in search of new places to buy.
During this crisis,
Anna Adams says some have signed contracts and even made partial payments.
they're then told it's going to be delayed 3-4 weeks.
To help, GHA started vetting new vendors, about 50 so far. About half are believed to be scams, several tied to the same supplier. Some medical clinics are desperate for a deal, even when legitimate products are available, because prices have skyrocketed.
The N95 masks problem has gone from, I would say, 600% increase in price.
Hand sanitizer, gloves, and face shields, everything costs more due to limited raw materials, sick workers, or simple supply and demand.
But at the end of the day, we as consumer, at the end of the supply chain, we have less way to discern whether this is legitimate product or not.
But careful what you buy, you may get what you paid for. Mayman says he has applied for another grant to work with police and actually buy some of these products. He wants to follow them through the supply chain and see how many of these dark web vendors are actually selling legitimate goods. Now, throughout this pandemic, you have probably seen more color-coded charts and graphs than you ever wanted. Some of them are helpful, others confusing, but there is one that has constantly raised questions with our viewers. This is the chart the Department of Public Health puts out each day to represent the number of new cases reported to them in the last 24 hours. It looks pretty similar to what we show you with our own graphics after we've had some time to poke around and vet the numbers a bit. But this is also a chart DPH puts out each day on new cases. It is the same timeline, but looks wildly different. Why? It's kind of like opening a time capsule, because once a positive case is reported, a contact tracer helps walk that person back in time to figure out when and how they got the virus. Was it that birthday party, trip to the grocery store, or perhaps a neighborhood social? It is that date that gets put into the second graph. Just look at July 6th. As far as new cases go, we might have been sighing a sense of relief. There were only about 1,500 new cases that day. But as time went on and contact tracers did their job, we realized there was more COVID in our community that day than at any other time in this pandemic. 5,800 people sick at one time. For Georgia, that's a record. So this drop you see doesn't mean the virus is gone. It just means we haven't tracked the virus back yet. What is a better real-time indicator is active hospital patients. These are people we know who are sick with the virus right now. And it tells us, regardless of which graph you view, the virus is still very much with us in our community.
Next, the role of faith during the pandemic.
During these months of illness and uncertainty, some have found strength in their faith. But it isn't always easy for those leaders to find ways to connect, especially at times of grief. Matt Pearl talks with 3 faith leaders who have found new ways to comfort their communities from a distance.
People are feeling isolated, people are dealing with depression, people are worried, people are afraid. And where do they often take that? To their faith leaders. I'm Dr. Tony Alvarado.
Rabbi Peter Berg.
My name is Fahid Ali Mawakil. As Muslims, our religion calls us to get real close, even in prayer, even in congregation.
At the conclusion of a Shabbat service, for example, people gather and they hug each other and they eat and they drink.
We lay hands on people when they're sick. We pray for people by laying our hands on them.
Human touch is so important to every faith tradition and to human beings, and we've just lost that. I've learned how to do Zoom conversations with people in the hospital.
To not be able to gather at a funeral, not be able to, we gather before, during, and after the funeral. The emotional healing that takes place, the spiritual healing that takes place from the community, I'm afraid is lacking.
I think the faith leaders have this, dual role right now. We're trying to take care of our own families and we're trying to take care of our flock, our congregations.
We believe that nothing happens unless God allows it.
We're all experiencing it in the business world, in our homes, with our families, and in the faith community. We are all in this together.
Thank you for watching The Reveal, the nation's only weekly local investigative show. We'll see you next week for another episode of The Reveal.